Today we're talking about crowns. Not this kind of crown, but the crown that you put in your teeth. And joining us this morning is dentist Dr. Jane Dodson. Thank you so much for coming on the show and making me wear this. May I take this crown off now?
You sure may,
Thank
because
you.
that's not the kind of crown we're talking about.
We're talking dental crowns. Now, I'm going to ask you probably a very simple question that you're going to laugh at. What is a dental crown?
That's a fair question.
Okay.
And you evidently never had to have any of your teeth replaced because they were badly damaged. But a dental crown, if a tooth has gotten like trouble, like let's say more than half of it's missing, then the crown gives it back the strength it had before any problem occurred. So that's a good thing.
Why would someone need a crown? Like, give me some certain examples.
Well, if you had a cavity at 6 and then a cavity at 12 and a cavity at 20, and now there's not much tooth left. And when you prepare the tooth and get rid of all the decay and cover it with a crown, now it got all its strength it's had back at 6 before it got the first cavity.
Are there different types of crowns depending on the damage to the tooth?
Yes.
Oh.
Yeah.
How many different types?
Oh, many. But the two big categories are a crown that is metal underneath with porcelain on top. That one is very good for the back because it has a lot of strength. But in the front,
yeah, you've
it's
actually
really
brought some.
nice.
So
yes,
can you show us? Actually, you could pull this up and just point it to camera 2, this one in the middle, that if you're going to be talking about specific ones.
All right. So this is a crown that has metal underneath. I guess.
Actually, if you want to pull it up, can you use those? What are those, sutures?
No, the sutures. I'm
just joking.
No, this is a crown
everybody.
remover. A crown remover picks up things, and you don't have to put fingers in one's mouth. But anyway, this has metal underneath, so you can see the metal.
Oh yeah.
And then porcelain covering it to make it look like a tooth.
Okay.
And this is even better. And now it comes as strong as the metal. This is a crown, but it has no metal. It is lifelike. In other words, you know how the light goes through your fingernails? Well, the light goes through this crown as well.
There we go.
I think you can see my fingers better.
Well, you could see, yeah, just if you, there you go.
I wanted you to be able to see that this has, it doesn't stop light, like a fingernail doesn't stop light. So the light will go through it and it'll look very natural on a front tooth. Everybody's seen someone with, it looks like a white patch on the front.
Oh yeah.
Doesn't look good.
No.
No. And so you don't want white patches, but if you have a crown like this, here's another one, where the light completely goes through, then it'll look very natural.
Oh, nice. So what kind of prep does the tooth have to go through before you put a crown in?
Best way to think about it is like a thimble on your finger. It has to have parallel sides, and if it fits tightly, the crown will stay on. But if it's teepeed, like the Egyptian pyramid, it'll fall off. That's no good.
Can you get a crown on any tooth?
Yes, really any tooth.
But depending on where it is, that actually makes you decide, okay, what kind of crown that you put in?
What makes a difference is the bite. For people that gnaw their teeth a lot, you know, like grind their teeth. Right. These non-metal ones are a little harder. But generally speaking, it's possible for everyone to have a great smile.
All right. Well, thank you so much.
You're welcome.
Yeah, you even got me to wear the crown right there. So if you want to contact Dr. Jane Dodson, DDS and Associates in Bedford, give her a call, 440-439-2230, or go to clevelandgentledentist.com for more information.